Our last speaker comes from the California Orthotic and Prosthetic Association.
Thank you. Chair and members, my name is Spencer Greene, and I'm a certified orthotist and prosthetist, as well as the current president of the California Orthotic and Prosthetic Association, or COPA. I entered into this field to design, fabricate, and fit devices that improve mobility and quality of life for individuals with physical challenges. Orthotics like this are braces that support dysfunctional limbs, and prosthetics are devices that replace an amputated limb. Many devices that orthotists and prosthetists provide are custom molded to the patient and are the result of a careful evaluation, a mold of the limb, and several outpatient follow-up visits, which ensure appropriate fit, function, and outcome. When patients do not receive consistent care, their independence, mobility, and quality of life suffer. In direct correlation with these impacts, the cost to the healthcare system increases. The California Orthotic and Prosthetic Association is here to advocate for the hundreds of thousands of device users in California who rely on our members to provide them with care. Today, the average reimbursement for orthotic and prosthetic devices by the Medi-Cal program is 49% of the current Medicare payment and is the lowest in the United States. COPA is requesting MCO tax investment to increase reimbursement to no less than 80% of prevailing Medicare rates. As a result of the stagnant Medi-Cal fee schedule, the cost of the orthotic or prosthetic device is often more than the reimbursement. Therefore, providers are faced with the dilemma to provide the device at a loss or to deny care to Medi-Cal beneficiaries. When care is denied, this vulnerable population of mobility-challenged Californians are required to travel further to access necessary care. As a result, many patients decide to forego treatment and resort to using a wheelchair or other assistive device, which decreases independence, productivity, and ability to complete activities of daily living. Achieving reasonable reimbursement will encourage providers to re-engage with the Medi-Cal program, which will result in decreased use of pain medication, decreased reliance on transportation services, increased opportunity to gain employment, and increased quality of life. The good news is that the savings to the healthcare system outweighs the investment in orthotic and prosthetic care, a net positive impact for California. COPA has contemplated the impact of a rate increase, which is somewhat difficult to quantify due to inconsistent reporting. However, we can extrapolate the impact by examining the largest provider of O&P devices in the state. Over the last 10 years, they have closed clinics in high Medi-Cal density areas secondary to business challenges, including reimbursement for devices. Examples include Gilroy, Burbank, Santa Cruz, Woodland, Fairfield, Grass Valley, Pinole, Lodi, Red Bluff, Chico, and Oroville, to name a few. Upon MCO tax investment, we would expect to see improved access to care in brick-and-mortar facilities or mobile care units. There's a well-documented link between access, quality of life, and decreased healthcare cost. When you are mobility challenged, your likelihood of accessing care increases the closer to your home you are. Several recent peer-reviewed studies have quantified the impact of orthotic and prosthetic care. Some relevant facts from these studies are that device users who are employed have 3.6 times greater odds of reaching increased mobility compared to those that are unemployed. This underscores the correlation between employment and mobility for lower limb prosthesis users. Another statistic is that receiving a prosthesis within 3 months of amputation results in $25,000 less healthcare spend in the first year compared to those that received no prosthesis at all. Lastly, patients who received a lower extremity brace incurred more than $1,900 less healthcare spend in 18 months after receiving the device as compared to those that received no device. In conclusion, Medi-Cal beneficiaries deserve equitable access to orthotic and prosthetic care. Quality care strengthens the Medi-Cal program by decreasing spend elsewhere in the system and promotes independent, healthy, and productive lives to vulnerable Californians. We are a state that prides itself on supporting our people in need. Our current status of having the lowest relative reimbursement for orthotic and prosthetic devices in the country is not consistent with our words. We appreciate your consideration to support orthotic and prosthetic device users by investing MCO tax money in the category of other outpatient services. Thank you for the opportunity to speak today.
Thank you. Director, I don't know if on any of the topics we talked about, you're like, hey, we already figured this out. They're totally fine. Or anything similar to that. You're close to that. I just want to make sure there's nothing in the works or plan for any of the topics we've talked about.
I mean, I would just say thank you to the kind of the providers and the provider associations for your commitment to Medi-Cal, and to the panelists who advocate on behalf of our members. I mean, I think to some of the earlier points before, there are probably opportunities for many, many, many more investments in the Medi-Cal space, but notwithstanding the state's fiscal situation, I think, we have our proposal before you, and I know there will be further conversations.
Okay, just wanted to clarify that. Okay, great. Thank you so much for coming to the table, and I appreciate hearing all your requests and see what else we can do. And I want to correct myself. I got my numbers mixed up. It's $20.8 billion that we're working with for the MCO tax, and 7.1 of them is for Medi-Cal reimbursements. And while we don't have three actual numbers for requests from the stakeholders here, that amounts to close to just 1% of the total allocation. If we were to fund every single one of these stakeholders, it amounts to 1%. That's it. If we went a different route and we didn't just allocate 1% and we looked at the equity or the labor workforce, then it would still leave money left over under the equity and labor workforce. I'm imploring the department and the other stakeholders, once again imploring that we find ways to include new friends in this proposal. Because the things we talked about here are preventative in nature. Some will save us money in the long run. And we're not talking about general fund money, because this is regardless of the current state of our budget situation, because this is money that is outside of that. These are entities that are helping our most vulnerable individuals. This isn't something that is an option for people. I don't think it's an option if you need a prosthetic. That's the only option you have. Or if you're trying to not be isolated as an older adult and dealing with depression or anxiety, it's helpful to go to adult day programs. If you're an individual with complex needs who perhaps maybe has no family member to take care of them and needs a higher level care than a SNF, CLIF is your only option. Or community health workers, who I know very, very well because I led a team of community health workers in my district. And I know that sometimes they're the only trusted messengers. And when we talk about equity, you can't talk about equity without community health workers, because they're the ones that our communities trust. Or private duty nursing, to ensure that our parents are next to their kids every single day and not have to maybe pencil in when they can go visit them because they're so far away. And all of this will help the workforce, every single one of investments. Or continuous Medi-Cal coverage for our kids. The whole point of this is for kids, right? To ensure that we're covering and ensuring we have access to Medi-Cal. We heard the story of someone having to wait till they get referred again or added back onto Medi-Cal to get coverage. And we know I've gone to a chiropractor for back issues, and that's preventative from surgery or anything, right? That saves. All of these are all preventative. So again, I'm imploring that we come back to the table and look at what else we can do to take advantage of the MCO tax for the first time ever in investments in Medi-Cal. Colleagues, Senator Eggman?
I would just like to concur with the chair and also just raise the point, as you've already done, that we keep talking about we need more healthcare workers, we need to increase the amount. We have healthcare workers in front of us right now that aren't being paid equitably. So if we want to really invest in equity, we need to look at what we already have.
1983. 40 years.
Were you born yet, Madam Chair?
I was not born yet.
All right.
I was before my time.
Madam Chair, I will say that, I think to some extent this is not the administration's fault. We tend to focus around here on the issue or the project or the program that's the newest and sexiest, that gets the most attention in the newspaper, and we often don't come back and take a look at the programs that have been around for a long time that need help. And nothing like a good budget crisis to force us to do that. And it really requires more than just the 3, sometimes 4 people who sit on this subcommittee to do that. We're going to have to take a look at the budget holistically and take a look at the programs that, as our chair, our superb chair, by the way, has said, take care of the most vulnerable in our critical communities, where there are no other services, or there are no other services that meet the need. And we're going to need to figure out how to properly fund them. And if that means we jettison some high visibility, sexy projects that don't come anywhere close to what you do every single day for the people that we care the most about, then I guess we're going to open the door and throw them out without a parachute. Thank you, Madam Chair.
I've often said instead of innovation grants, we should do sustainability grants.
Sustainability. That reminds me of one thing, the Innovation Accelerator program that I've mentioned in this committee. What's it for? We already know what we need to close the gap. And we're putting aside, what is it, $40 million for that? 74 to tell us what we need to do to close the gap on equity. Faster. It's right here in front of us. You're right, Senator Roth, you're right. I mean, I think my plea should be directed to the stakeholders we heard in panel 1. To be like, don't fight us in our requests to include more friends. I think that's where my plea should go. Employing those stakeholders to not fight us. Because you're right, Department. I mean, at the end of the day, you're like, we're just getting our orders and we're going with it. You're right. So it's the other stakeholders. I hope you heard what's at stake here. And your members are getting a huge piece of the pie. They're just asking for a crumb. That's all they're asking for. So with that, thank you so much, panel 2. We're going to move into public comment.
Good afternoon, Madam Chair. My name is Karl Cook. I'm a disabled Air Force veteran. In January 2023, my right leg was amputated below the knee because of a chronic infection that rendered me unable to walk. After my amputation, I was sent to a VA rehabilitation facility in Martinez so my wound could heal and I could regain essential life functionality. My wound healed quickly, I was casted for a prosthetic leg, and my leg was delivered in March of 2023. Physical therapy began teaching me how to walk. I was sent home 2 weeks later with a wheelchair, a walker, and a plan to be followed at the outpatient Mather VA physical therapy clinic. The following 2 months involved a lot of follow-up visits and testing of prosthetic components to provide me with the best functionality. I was working with physical therapy to learn balance, strength, and how to use the walker and eventually walk with my cane. As of June 1st, 2023, I returned to my full-time job as a budget analyst with CalSTRS. I have continued to participate in physical therapy programs such as the PGA Hope Golf Program.
Thank you, sir.
And recreational therapy bowling sessions. I'm an active musician.
You have to wrap it up, sir. Sorry, just one
Yes,
minute per
ma'am.
person.
Today I want to urge you to allocate the MCO tax investment dollars into orthotic and prosthetic care.
Thank you. Thank you so much.
Yes, ma'am.
Thank you, sir. Thank you for your service.